It's very important that the community know that we've been working with all of our partners, and I call it chain of protection, where every link in this chain has to be strong, and if we don't have strong links, we could have infection spreading in the community. So we have been working with multiple different agencies. It's important our community realize we've worked with our school boards, and I'm confident now that the schools are closed, that we're not getting propagation in children. And I'm not confident when the schools will be able to reopen, because children can propagate the infection and can have minimal symptoms and shed virus longer than adults normally for any respiratory infection. So schools may have to remain closed. Colleges and universities have changed the way they're doing business, and they're moving on to distance education. Our hospital partners in the last several weeks have been preparing an increasing capacity and trying to get more ventilators and more bed capacity. We've worked very diligently to prepare teams to support our long-term care partners and their clients and ensure that we have good outbreak management. Visitors are limited, staff are screened, and the same is true in our retirement homes. We've worked with our primary care partners who have helped support our assessment centers, both in Lennox and Addington Community General Hospital, as well as at Memorial Arena. Our military has been a great partner, and our significant number of individuals in our community, and they're preparing to provide medical support for their community. Corrections Canada has been a great partner, and they're trying to prepare for any entry into their facilities by screening individuals and screening staff and having a protocol by which they can provide care to their clients. We've had great partnership with all of our government partners in essential services such as fire, EMS, and police. We've worked closely to support our homeless and vulnerable, looking for alternate ways to provide housing to these individuals so that the number of individuals in one room can be lessened. And we're trying to support families during this stressful time and give support and recommendations on how to build resilience and support families as they have to socially distance and deal with school closures. And as an overarching, we've worked with multiple other different community agencies. So all of these agencies have been contacted, all are working together. I'm happy to say that we've had a great cooperation. We're all in this together, and each knows they have a key role to play to prevent infection coming into our community. And we've really benefited from these last several weeks to get all of our partners aligned and ready for any eventuality of infection coming into our community.